So let us continue with Nash therapeutics study streak. And so far, we have covered a lot of remedies. And in the last session, we took up two remedies which are very important for a homeopath, which is Ipecac and Antimtar. And today, we'll take another set of two remedies because the explanation of some remedies in groups of threes, groups of four, groups of five, groups of two is very well mentioned by Dr. Nash. So the remedies that are mentioned in the Nash therapeutics in a serial order, like ABCD in the other book, Dr. Nash mentions these remedies in a order which he feels are important for a homeopath to study. And I'm today picking up two remedies which are mentioned after the previous two remedies, which is Ipecac and Antimtart. Yesterday was the session we took, and today Dr. Nash, from Dr. Nash's book Leaders in Homeopathic Therapeutics, we are picking up Iris versicolor and Sanguinaria canadensis. So the first remedy, Iris versicolor, he mentions that another remedy which causes great nausea, vomiting, and it is serviceable in cholera infantum. Now, whichever homeopath writes a book, if a disease condition is widespread during that phase, he will write about those conditions and the remedy specifically in that book. So, here we have something that is uh, for cholera infantum. Dr. Nash mentions Iris versicolor as the remedy. We have seen at other places he has also mentioned carbovage, he has mentioned camphora, and some other remedies he'll be mentioning. But what is interesting about Iris versicolor is that he mentions that the substance is vomited out and that is sour and excoriates the throat. And he puts this in italics. And if you understand this word, which is sour and excoriates the throat, this is the secret to understanding Iris versicolor. The next line gives an indication of the remedy, and even if you don't know anything about the other details of the case, if you find this symptom, which is burning of the tongue, throat, esophagus, stomach, and anus, everything right from the tip of the tongue to the anal region, there is burning. And this is all accompanied with profuse flow of saliva. We saw this in Ipecac. If you are not giving Ipecac for profuse flow of saliva in all complaints associated with the presenting complaint, there is profuse flow of saliva, Ipecac needs to be thought of. Just like we think a heavy and indented tongue for Merxol. So for profuse flow of saliva with burning in the throat, tongue, throat, esophagus, stomach, anus, the entire gastric tract, Iris versicolor is the remedy which Dr. Uh, Nash gives us. And then he gives us a case of stomach trouble in middle-aged lady who had vomiting of long, stringy, glary mucus which was ropey in nature, and he assumed that this lady had cancer of stomach and gave uh, kali bichromicum because of the nature of the vomit. There was no benefit. So a homeopath who is publishing you a case of failure and still you are not reading the book is really a pity. We go to attend seminars, and in the seminar there are homeopaths who will uh, present to you a case which will probably not be cured with that remedy, something else. you will see a case from a homeopath in such a big seminar which is cured after failure of 10 remedies, but what you see is one remedy presented to you. In Dr. Nash's book we see the reality what he mentions for the cases that he saw, for the remedies that he gave and how he failed. After giving kali bichromicum, the patient didn't improve, assuming that she is a case of cancer. Dr. Nash told that the very next remedy was Iris versicolor, and this cured her completely, and she lives well for 10 years since that episode. So there are innumerable cases in the Nash therapeutics for a homeopath to take inspiration from, apart from the one sentence, two sentence inspiration boosters which Dr. Nash gives in his book. So it is really vital for a new beginner or a professional or a senior homeopath to read this book once a year at least. This should be a ritual which you should follow. Iris versicolor, Dr. Nash mentions for sick headache, hepatic or gastric origin, and the prodrome is blur before the eyes. We saw a certain kind of prodrome in Kali bichromicum also, which is blindness before the eyes. And here there is blur before the eyes. So if you know the difference, if you can ask the difference from the patient, your job for prescribing in such cases becomes easier. And he has used third potency to 50 m with good success in all the cases. Dr. Nash gives iris in cases of sciatica also and skin troubles also. It is recommended in various textbooks, but Dr. Nash tells that he has not used much and he closes the talk of iris versicolor right then and there. The next remedy what Dr. Nash picks up is Sanguinaria canadensis. And if you are treating migraine cases, this is going to be a very vital remedy to prescribe in all the cases of migraines. So, all the patients who have migraine treatment from you, chronic, they should be given acute medicines like belladonna, glonoine, iris, sanguinaria with them, because most of the acute episodes will be managed by either of these few remedies. So, Sanguinaria canadensis, Dr. Nash mentions for sick headache, and we all know the symptom is from the back of the head to the right eye. If it is left eye, it is spigelia, and there is nausea and vomiting with the complaints. Patient feels better in the dark and wants to be quiet. This is the most common presentation in all the migraine cases, so it is not unique to sanguinaria, and we should know this. What should be important is the uh, type of pain and the associated complaints with the main complaint, which is over here nausea and vomiting. And it is like a specific remedy for American sick headache, which Dr. Nash gives in all such cases in the 200 potency. In presenting complaints of the respiratory tract, Dr. Nash mentions sanguinaria for loose cough with bad smelling sputa. And if you have attended my previous sessions, and in one of the remedies, Dr. Nash gives us a description of cough of sanguinaria, where he says that if there is an offensive sputa, the patient will tell you, or else you will need to confirm from the patient whether the sputa is bad smelling, whether the sputa is sweetish, stannum metallicum, whether the sputa is salty, phosphorus and sepia, or if it is smelly, the remedy that we are discussing, sanguinaria. And there is pain behind the sternum like kali iode. And this type of cough, Dr. Nash tells, comes after severe bronchitis or pneumonia or a long standing chest trouble. So nowadays, we homeopaths would not be seeing so many pneumonia cases like the earlier homeopaths saw, or the earlier physicians also saw. The reason is the introduction of vaccines, the introduction of the super specialists and the patients rush to them, or the ease of hospitalization, or the ease of availing mediclaim for their hospitalization, and they feel that why to put the patient in so much trouble. But any long standing respiratory trouble which is persisting for a long time, and then the cough is the presenting symptom with bad smell or offensive smell, sanguinaria is the remedy that you can immediately think of. And he claims that for fevers he has given with red cheeks as a indication. Dr. Nash quotes Dr. TL Brown, and at many places he has quoted Dr. TL Brown. Maybe he is one of the persons he looks up to, and he tells that Dr. TL Brown used the first trituration of the alkaloid. Now, the first trituration of alkaloid means the 1C or 1X potency, and he found it very useful. Dr. Nash told I found it useful from the first trituration to the 50M. So there is a plenty of scope for everyone to experiment and find out what remedy and what potency to be given in such cases of fevers and cheeks and with red cheeks and respiratory troubles. For all the right lung affections, or you find when you examine the patient, and we had discussed yesterday also that whenever you see a patient, there are very few homeopaths who will explain you how to clinically examine the patient and decide on a remedy. And in one of my clinical experiences I have shared earlier, something more will be coming very soon for all of you to learn. But we discussed yesterday about how you will differentiate Ipecac and Antimtart while clinically examining the patient. And in short, we discussed and how Dr. Nash has mentioned that there will be dullness on percussion, and you will not, feel some respiratory movement in that part of the lung. So similarly, in sanguinaria also you will see that the right lung is getting right part of the respiratory organ is getting congested or will get congested with the red cheeks, and again the right shoulder is affected. The patient cannot raise the arm and it is aggravated at night. So all the cases of frozen shoulder, which is again another difficult disease to treat, sanguinaria is one of the remedies that will come of use. Another remedy that you can keep in mind and you can differentiate is chelidonium. One of my patient had pain in the shoulder while bringing the arm down, right shoulder, bringing the arm down. Chelidonium worked well. Sanguinaria, I have given in a few cases and found good results. Sulfur has also helped. So sanguinaria has a kind of a phase of sulfur in its presentation of different complaints. Flushes of heat with hot palms and soles. You will see this in climatic ages and also in different patients. And what is interesting is Dr. Nash ends with telling us that sanguinaria is a remedy which is indicated after lachesis and sulfur have failed in climatic age, especially if there is presentation with little bit of redness of cheeks or circumscribed cheeks. So that's all from today's session on these two remedies from Dr. Nash's Leaders in Homeopathic Therapeutics. If you have found it useful, let me know in the comments. And if you're not reading Leaders in Homeopathic Therapeutics by Dr. Nash, it is high time. We are almost halfway in understanding what is written in the book and how it is helpful for each class of homeopath, whether you are a beginner or a senior homeopath. So follow Homeo Setu on Instagram, YouTube, Facebook, WhatsApp channel, everywhere, and stay connected for interesting learning.